You may be increasing your risk of stroke as well as dementia if you are taking calcium when you don't really need it. The old studies regarding bone density in women said that it was a great recommendation to go ahead and take calcium on a regular basis. And still, we know that studies do show that taking calcium do tend to support those with bone density issues. The problem is, do they really need it? And are there other issues that are going on that are preventing calcium from absorbing effectively? And that's why the new studies show that probably everybody recommending calcium to everybody, every lady over the age of 50, isn't necessarily a good thing by itself. Vitamin D, that's the next one that came out and said, hey, everyone should be taking vitamin D because it helps with calcium absorption. Great, that's true. Unfortunately, sometimes vitamin D, if you're not taking vitamin K2 with it, will cause your calcium levels to not really be utilized effectively. That's why most supplements now that are really focused on bone density are going to start recommending that vitamin D and K2 be included. The bottom line is this, is that you should be speaking to your provider about whether or not calcium is something that you should be taking. Vitamin D, well, that's something, of course, you should be testing for. Not to test is to guess, to test is to know, and you can test for that easily. Those that truly have bone density problems may also benefit from taking strontium, magnesium, as well as even melatonin. These other recommendations should not be really taken just by anybody. You need to get to the cause of the condition and see where you are lacking and not just start taking a bunch of supplements just because they sound good. You should be taking things according to your needs and not just according to an infomercial. So talk to your provider about these important issues about osteoporosis, osteopenia, and what you should do about it. Check us out on our live streams on YouTube on Thursdays at 7 o'clock.